Dr. Sullivan is full of energy and passion and great ideas, and it's hard to be around her and not essentially catch all that energy and excitement. And she's really a strong advocate for patient care and caring for communities, and she's just great to be around.
First of all, she's an excellent advocate for residents. I work with her as one of the chiefs in our program, and she is always supporting residents and kind of helping us meet our needs. Secondly, she prioritizes both faculty and resident wellness. So taking time to teach us about efficiency and how to use the EMR to our advantage so that we're not in clinic spending, extra hours that we don't need to be writing notes. And then kind of beyond the residency standpoint, she's an excellent patient advocate, physician. She's taking care of a huge vulnerable population of our LGBTQIA patients. She's kind of locally known as our transgender health and gender affirming care expert, and is constantly teaching us how to take better care of these patients, but also taking excellent care of them herself. And then the last big thing is, after Roe v. Wade was overturned in June, some people had reached out to her saying like, hey, we need to do something about this. I think it's really challenging to be in a helpless position. And she took charge on making a rapid access contraception clinic at Sugar House. So now we have a fully functioning rapid access contraception clinic that we can see at least 6, sometimes more patients in a week. And we're able to provide long-acting contraception, birth control pills, you name it, in a timely manner for patients. Because as most people know, there's a big access issue getting into really any clinic, and especially for a procedure type slot. And just her taking the amount of time to set this up, to volunteer at it, and to teach residents at this clinic is, I think, really phenomenal.
So one of the first physicians we met was Dr. Sullivan, and she's like very spunky and rambunctious and like so honest and authentic, and had like amazing perspective, because she was like a resident of the University of Utah and then left and then came as an attending. And so she knew how the program worked, and like there was knew that there was areas to grow in, and especially in the EPIC efficiency department. Basically, she created her own curriculum to help us kind of get oriented to EPIC and like know how to just like be efficient with EPIC and using dot phrases and being able to pre-chart really well. And I thought that was extremely helpful. And then just seeing her as a physician when we were in clinic is really rewarding, and definitely a role model in terms of how she like interacts with patients, and then how she just can click all the buttons really well in EPIC, which is quite the skill, as I've come to learn.
When she was a new faculty with us, I vividly recall her standing up at a faculty meeting and telling us that we were all doing EPIC wrong. We weren't using it to its full capacity, and she was going to teach us all how to do it correctly, and we were going to do it the right way, and it would be her way. And I thought that took an awful lot of confidence and gumption as a new faculty to stand up and tell everyone that, but she did it, with a smile and a laugh, and she was right. We all were not very efficient, and she helped us to become a lot more efficient and a lot more streamlined and coordinated in what we were doing with our documenting and charting. She's extremely knowledgeable in many areas, but in particular with LGBTQ issues, and in particular transgender health. She's the one who really got our transgender clinical practice off the ground and really expanded it, and collaborated with physicians in other departments within the university, including surgical subspecialties. And she has just really been central to making University of Utah clinics really nationally known for our transgender care offerings.
I had actually posted on Facebook, just kind of generally to my friends in Salt Lake, just asking if anybody knew of a GP or, just a provider that wasn't overtly fat phobic, having kind of some less than desirable appointments with people where the focus was just on weight as a number as opposed to other markers of health. And so I was just like, I'm ready for change. I'm going to see if I can find somebody else. And one of my friends suggested Dr. Sullivan. And like when I called to make an appointment, they were like, oh, unfortunately, her books are closed except for LGBT people. And I was like, yes, finally, I'm getting a benefit from being queer.
So I was looking for a general provider who could help me out with getting access to PrEP. And so I went online looking for LGBTQ friendly doctors, and Dr. Sullivan was one of the first ones to come up. I reached out, scheduled an appointment, and I mean, literally like in the first visit, I knew that she was going to be the doctor for me. She was just so open and supportive. She knew exactly like what I was looking for and was really supportive in helping me get access to PrEP, and has just, you know, become a really close friend and a mentor. And I just love her to death. I mean, she's the easiest person to talk to ever. She's just so supportive. And I really love having her as my doctor.
I feel that she sees me as a peer, like a peer professionally, intellectually, and like we're working together on a project like I would have with any other part of my professional life, right? Like the project is my health, but like she and I are both collaborators on it, and like she has important information that I need, but it's not from a sense where it's like she's going to tell me what to do. It's like, I'm going to share this information with you, and then we're going to work together to achieve whatever, you know, whatever the health goals might be.
I think one of the most, you know, impactful moments for me was like I would see Dr. Sullivan in my regular checkups and things like that. But I remember going to, it was one of my first Pride parades, and there she was sitting at the you know, the booth, like chatting with people and supporting them. And so she is, I mean, she embraces the community, not just as a profession, but as a way of life. You know, she wants to be a part of people's lives. She wants to be supporting them wherever they're at, whether that's in the doctor's office or at the Pride parade. You know, she just really gets it. She understands what it means to be a care provider. And she shows that she really cares.
Congratulations, Dr. Sullivan. You have earned it above and beyond based on all the things you've done for this program and for us and for the community at large, especially the transgender community that you have been such an advocate for, and just generally such a great teacher for us as new budding physicians. And then I'm sure we'll looking forward to working with you in the future.
Congratulations, Erica. I'm really excited you won this, and it is very well deserved.
Congratulations, Dr. Sullivan. I think you should be United States Physician of the Year, but Utah's pretty good. And I also feel like, you know, not just as a patient, but like knowing about her work with the Rapid Access Contraception Clinic, like not just, it's like a huge benefit to me to have Dr. Sullivan as a doctor, but I think also I'm glad she's getting a statewide award because the work that she does benefits all of Utah. And I'm really glad that she's chosen to practice medicine here.
I actually got to be with her when she found out she won this award. She opened the email and I was sitting there, and it was really special to see, first of all, how surprised she was, but then second of all, just how joyful it makes somebody to get recognized in this way. And today is her birthday. I will not say how old she is, but happy birthday.
You know, I love you to the moon. I think you're the most amazing doctor ever. And I've loved, you know, becoming friends with you, but I'm just so appreciative of everything you do for me, everything you do for the community. I'm so appreciative of your optimism and, you know, just the spirit that you bring to everything that you do. I'm so proud of you.